for having me. I'm hoping this will be informative. Just disclaimer, I could talk about balance for like 2 hours, so obviously I'm not going to, but I wanted to kind of bring to everybody some things that we educate our patients at when they come or with when they come to us. We see a lot of folks who have arthritis, but end up, with some other acute, medical issue where they end up in the hospital, get weaker, and need to come to us for intensive rehab. So, first off, show of hands, how many people have ever lost their balance? Everybody's hands better be up. If they're not, you're lying. So, the difference between losing your balance and falling versus losing your balance and staying upright is very minimal. So, what I wanted to bring to you was just a little bit of education on balance, what happens when you lose your balance, and some things that we do with our folks from a therapy standpoint that's, inpatient, outpatient to challenge your balance, and some things that you can also do at home. The other thing that I wanted to make sure, and I think I have an objective slide here, but the other thing that I wanted to kind of give to you over the 13 years that I've worked at Encompass, I have learned a lot of different about a lot of different mobility devices. I always have patients that are coming in that are saying, I use this at home, or I saw this on Amazon. What do you think? And a lot of times we will purchase these things to have at the hospital to trial with people because we'd rather you trial them with us than, waste your money if it's not going to work for you at home. So I brought a couple things today too that I will show you, and I'll have them in the back at the end too. So if you're interested in looking at them, that I feel like a lot of people are not familiar with or haven't, have no idea that they're even out there. Some of these mobility devices you may never need, but you might have a friend or a family member that could benefit from it, a neighbor. So it's just to give you a little bit of a wider range of understanding of the different mobility devices that are out there also. So what happens when you lose your balance? There's 3 strategies that happens with your body when you lose your balance to try to keep you upright. Your ankle strategy, your hip strategy, and your stepping strategy. So when you start to lose your balance, the first thing that kicks in are those muscles in your ankles. So you can think back to a time when you lost your balance, maybe you were walking or standing, lost your balance. Those muscles in your ankles start to kick in to try to keep you from falling. So if you have weakness in your ankles or issues with your joints in your ankles, it does put you at a higher risk for this strategy not to work. If your ankle strategy doesn't work, then your hip strategy kicks in. That's when you see people kind of doing the hula hoop, with their hips, trying to keep their balance. Again, if you have muscle weakness at your hips or issues with your hip joint, that's going to make you more at risk for falling, and this hip strategy can't kick in and work. The last thing that happens, so if your ankle strategy fails and your hip strategy fails, you take a step to try to keep yourself from falling. For some people, if they have a lot of weakness in their body or, their joints aren't working the way that they need them to, that step may not happen in time, and then you end up on the ground. So I educate my patients constantly on what's happening when you lose your balance. And then we try from a therapy standpoint to strengthen those muscles and to try to help to better those strategies so that if you do lose your balance, because everybody does, you will lose your balance, to try to keep yourself from ending up on the ground. There's different ways and different stances that we'll utilize with our folks when we're talking about balance. And you can go into a huge array of how to make things more difficult balance-wise if you're challenging your balance. But some things that we'll do with our patients is just kind of an overall assessment of how their balance is. And you can do this very quickly. You can do this at home. I would suggest obviously have another person there if you're concerned about what your balance might look like. Or, holding onto a chair or a countertop so that if you do lose your balance, you have the ability to hold on to something. But the first thing is a normal base of support. So you can stand with your feet just kind of shoulder width apart, and see if you can maintain your balance. And again, there's ways to make it harder also. You can close your eyes. When you take your vision out of it, it makes it a little bit more challenging to maintain your balance. The other thing that you can do for all of these, and we utilize foam. So if you take yourself off of a hard surface where you can kind of feel it, that sensory is an important part of your balance, and you stand on something like a foam piece of material, that's a challenge to your balance. If that's easy, you can close your eyes. That makes it even harder because you're taking your vision and your sensation out of that. So those are some things that we will do because, again, as therapists, we love if something's easy, we love to make it harder. So if you've ever done therapy, you know exactly what I'm talking about, right? So the next stance that we can do to challenge somebody's balance or to just check and see where their balance is a narrow base of support. So your feet together, as close as you can get them. For some people, because of weakness or arthritis or some joint issues, a narrow base of support can be very, very, very challenging. And at Encompass, what we do, and as inpatient rehab therapists, our focus is a lot on function. So if you think about times when you have to have a narrow base of support in your everyday life, there's a lot of different times. If you're moving around in the kitchen, in the bathroom, sometimes, if you're in tighter spaces, you're going to have a narrow base of support. So that can put people more at risk for falling if that's a little bit more of a challenge. Single leg stance. Standing on one leg, sometimes a little harder for me than the other. So going upstairs, you're lifting up one leg. If you're getting into the bathtub, if you're stepping over the bathtub, you're doing one leg, single leg stance. So that can be a little bit more of a challenge. And sometimes people have a really difficult time doing that. Tandem base of support is when you have one foot in front of the other, kind of like the field sobriety test, except you're walking. So you can try one leg in front of the other, and you're going to feel your ankle strategy start to kick in. Because again, your body is recognizing that you're not on kind of that normal base of support surface. So sometimes from a therapy standpoint, just getting people into that position is enough of a challenge to try to make them work on their balance. Sometimes we'll get real aggressive and start pushing them around a little bit when they're in those positions to, again, challenge your balance, because it's all about what's your body going to do if you lose your balance. So that's where therapy, whether it's outpatient, inpatient, really can focus on strengthening those muscles and just having your joints be able to respond well when you lose your balance, because it will happen. So you want to make sure that you're ready for it. So the next thing moving into, there's a lot of different ways that you can challenge your balance. From a therapy standpoint, we have endless possibilities of things that we can do from a balance program to make sure that we're challenging and really kind of seeing how your body responds when you lose your balance. So I talked about the foam. The other thing that we can do, and I brought just some cones that we have from, at the hospital. So you can put cones out around, and you talk about your single leg stance. Tapping the cone can be a challenge. You can do the same thing if you have a step stool. Anything that's going to make you have to stand on one leg can be a good activity if that is a challenge. Or your therapist may say, we're going to work on trying to have you step. You can put cones all around and step, move your leg out and about. So we will do this with our patients, when we're working with them. So that's just one activity that can really focus on balance. TheraBand, again, if you've ever gone to therapy, you probably go home with a nice little parting gift of TheraBand, because you can use it for a lot of different things. A lot of times we will tie that around patients' hips and have them do side steps, so that you're trying to strengthen the hips a little bit. Sometimes I'll even get creative and tie it around their hips to make it harder for them to lift their legs up. I always laugh. We have a physical therapist she's inpatient now. She used to be outpatient, and we always call her the aggressor, but she would tie TheraBand around people's legs and sit in a stool and have them pull her so that they're really strengthening their legs. And when our outpatient and our inpatient were together in the same building, our inpatients were always like, please don't ever let me have her, because they're watching her drag and be drug across the room. But again, patients love it, but they feel it because you're strengthening your hips. So there's, again, creative ways that aren't just sitting and doing exercises that we can do to make it fun, so you don't feel like you're working out, but can actually affect your muscles that then will affect your balance. A chair. So I always say, if you're going to do something balance related, have a chair or something that you can hold on to, because again, if you're going to lose your balance, you don't want to fall. So a chair can be very, very, very simple to use. Sometimes you can do an activity where you're sitting in a chair and trying to stand up without using your arms, without pushing off. That's a good exercise that also affects your balance, because there's times that you aren't sitting in a chair with arms. So you have to be able to get off a bench. You have to be able to get off, a toilet seat sometimes if they're lower. So those are good activities that it affects your balance, it affects your strength. So every patient that I touch, when I work with, I make sure that we practice getting up out of a chair without using your arms. And you can try that today if you want, when you go home. And it can be a little bit more challenging than what you might realize, especially those lower surfaces. Hurdles are another thing that we utilize quite a bit. So you can put hurdles on the ground. And again, it's that single leg stepping where you're stepping over top of the hurdles. We do side steps, again, where you're strengthening your hips. Things that aren't just the typical get on a machine, work your muscles. And a lot of times, because in inpatient rehab, our focus is function. So can we strengthen those muscles enough to be able to then have it correlate into function? So in order to work on your function, you have to practice that functional task. So then you ask yourself, what happens if, your balance is just not where you need it to be? You're at maybe a higher risk of falling, or your mobility is not where you really want it to be. So they have a ton of different mobility aids that you can utilize at home to try to increase your independence. So one barrier that we always find with our patients is that a lot of times they're very hesitant to trial a different type of adaptive device or mobility device, because they feel like it's not going to make them increase their independence, or they don't want somebody to see them using a cane or a walker or things like that. And that's a very common, thought process. And what we educate a lot with the patients is that mobility aids can actually increase your ability to be independent. Would you rather walk without anything and really struggle, or use a cane or a rollator that might really help that you can walk further, that you can do more things and be a little bit more independent? So this is kind of a quick list of some mobility aids that we'll talk about, but there are a ton out there. Insurance covers some, they don't cover everything. So Amazon is a place where we will direct a lot of our patients to, because things are a little bit cheaper sometimes than what you would get at a DME company. So we'll print out, kind of pictures of things that we're recommending. And again, we trial things with people before we recommend them at home. So canes, there are a bunch of different types of canes. So you have your single point cane, which a lot of people are very familiar with. A quad cane that also most people are more familiar with. So the two canes that I had never heard of before until I started working at Encompass, the Rock Steady cane up in the corner and the car cane. So the car cane is wonderful, and I brought one so people can look. This fit, sometimes, people really do struggle getting in and out of the car. Lower surfaces can be a little bit of a challenge. So this fits when you open the door, and the frame of the door, you see kind of that little square where the lock is, where it locks in. This fits right in the lock, and you can use it to push up out of the car. You can move it in whatever direction you need it to go. And we have people that use it to kind of pull themselves out of the car or push up out of the car. So if you're struggling or you feel like, it's too low, and it's very small, so you can keep it in the glove compartment of your car, which is really nice. The Rock Steady cane, which we had just become aware of this probably in the past 2 years that this even existed. So this is on Amazon. It's about $65, I think. So what we use this with a lot of patients are for stairs. So a lot of patients that we work with only have maybe one handrail, and that can be a challenge for them. And they really need something in both hands, but maybe a single point cane just doesn't give them enough stability or they're uncomfortable. So this can be adjusted so that one leg is longer and one leg is shorter, and it can sit then on one step and then the lower step underneath it. Everybody kind of understand what I'm talking about? So that when you push down, it's really like another rail. It's very sturdy. And again, I'll have it so if you want to push down on it, you can feel. This has been a game changer for some people getting into their house. We are in the Pittsburgh area where you have, 45 steps to get into your house, and it's really challenging. Stair glides are really expensive. Sometimes you can't get them, because of the layout, you can't get them, in or outside of your house. So, or another handrail placed. This has really been one of the favorites of people that come through our doors. It's something very simple. We have some people that like it so much that they'll use it when they walk around their house too, because it is a little bit more sturdy than just a single point cane. So you guys are welcome to try this, later on. But this is one that I think we recommend a lot for a lot of people, and they like it because it's not expensive, and they don't have to change, their home setup. They can use this, and you can take it anywhere. If you go to your daughter's house and they have, she has a ton of stairs and with one handrail, this can be really helpful. And it's, like I said, it's not very big. All right. Moving on. So walkers. There are a ton of different options for walkers. Some of the main ones that we use or recommend, you have the rollator, which is the one with the seat. So if endurance is an issue or you feel like you need to be going in a lot longer, spaces, you can lock it, turn around, and sit on it. We do have some patients that like it because they can store things in the seat. One woman had an array of snacks that she would often offer to the therapist as when we take her back to her room, and that's what she used it for. It was more for as a purse than necessarily a mobility aid. Hemi walkers for some of our patients who've had strokes or have, one side that truly is weak. They don't have really good grip, with one arm. A hemi walker can be a game changer as far as mobility. Platform walkers, some of our RA patients who, have a hard time grabbing onto a walker, sorry, I probably should have went with the headset, but they can rest their arms on the platform, and so they're pushing down through their forearms versus having to grab on. So you can get a walker with just one platform. You can get them with both platforms. Sometimes they will sell just the platform attachment if somebody has a walker already at home that can just attach to the walker that they already have. If someone falls, breaks their arm, if it's like their wrist area where they're allowed to put weight down through their elbow, we'll recommend a platform walker, for stability there. And then the regular wheeled walker, I think when we talk about walkers, that's what most people kind of think about. So some other mobility aids. Listen, I would have brought all of this if I had a bigger vehicle. But the bed rail is great because not everybody wants a hospital bed at home or needs a hospital bed at home. So you can purchase just a bed rail to put underneath the mattress or underneath your mattress and utilize if bed mobility is a little bit of a challenge for you, or if you need that little, something to be able to grab on. A slide board or a transfer board, you'll hear it called both things, looks very much like this. We utilize and educate people on how to use this constantly if they're having a really hard time standing up, or if, God forbid, you fall and break a leg and you're non-weight bearing and it's really hard, especially if, there's already arthritis in the joints to be hopping or standing on one leg. So this bridges the gap from where you're going or where you're coming from to where you're going. So it literally just sits underneath one side of your tush and you scoot across it to wherever you're going. So bed to chair, wheelchair to bedside commode. They sell drop arm bedside commodes that you can use this on. Getting in and out of the car. We teach people how to get in and out of the car with this, and you'd be surprised. If you can get a vehicle that's semi close to the height of the wheelchair, this can be really helpful to getting in and out of the car. So a lot of people aren't familiar that this even exists. So I wanted to bring it to you today, just so you are familiar that there's something out there like this. Leg lifters are helpful too, getting into the car, getting into bed. They look like, we always say they're the invisible dog leash. We've taught people to use sheets too, but you can hook it around your leg and lift it into bed. So if really you're able to do everything except get your legs into somewhere, that can be a game changer to help. They're easy to keep in the car, easy to keep by your bed. They sell different varieties. The other thing that we teach patients, and it's more so for caregivers, this one is more a good caregiver type of piece of equipment, are low friction sheets. So the beauty of this sheet is when it's folded on itself, it slides very easily. So for some of our patients, and again, it's more so if for you as a caregiver, if the person that you're helping is really having a hard time scooting up in bed, because we want to protect your joints and your back so that you don't get hurt, you can put this underneath them and it helps them to slide up and down. So we will teach families how to use this. And again, for some caregivers, it can be a huge benefit to have at home. We can teach people to use this with the slide board if they're having a hard time scooting or a caregiver's needing to help them. You really do need some education and insight, because with a low friction sheet, it can be dangerous. If you use it the wrong way, you can slide off of the board or slide out of bed. So, but this is something that is out there. So if you have yourself or a family member that could benefit from it, you can always ask, about that when you're talking with their therapist or anything like that. Okay. I think this is my last one, but the other thing, and this one is more for people who are truly struggling to be able to get up. We will trial, we call these Sprite lifts or Sarah Steadies. They come in a lot of different names, but they're sit to stand machines. And what they do is you can pull yourself up or get help from a caregiver to pull yourself up, and the flaps go right around and lock in under your butt, and they sit there. And then you can wheel them to wherever you need to the bathroom, to the bedside commode, to the bed, to the wheelchair. Again, this is more for a caregiver or somebody that is truly struggling to stand up, but it can be the difference of, a spouse being able to help their loved one versus having to hire caregivers to come in and do it because you can't lift, your husband or your wife. There are some DME companies in the area that have a rent to own option for equipment like this, so that you're not outright buying it. You can rent it for maybe a month, see if you like it, and then if you like it, you can rent to own. The last thing is a sit to stand assist cushion, which we have recommended, again, an Amazon purchase. But it gives a little bit of a boost to somebody in the chair if they're having trouble getting up out of the chair. So we've had some people that once they're up, they can get up and, walk around no problem, but it's literally that sit to stand that is an issue. People will sometimes get lift chairs, but if you're not in the lift chair, you can't get up. So this can sometimes be a helpful, piece of equipment for people who are really struggling to get up out of the chair. Any questions? Like I said, I'll have all of these in the back so that you can try them out. So So we put the hurdles, they literally go on the ground. So we're working on that single leg stance. So having to step over top of the hurdle. So it all comes back to, are you able to maintain your balance on one leg? So for some people, as soon as they go to lift that leg off the ground, they feel like they're going to fall backwards, or they're not lifting their feet up enough to clear the hurdle, which can be a challenge. And that can put you at risk for falling if you're catching your feet. So sometimes we'll throw, a line of hurdles out on the floor, and we're having people step over or side step over. And a lot of it's twofold for balance, but then to also kind of work those hip muscles also. They're not very high. They're probably the height of this. Does that make sense? So then you're stepping over top of something that is this height. So it's not like a hurdle like you'd think in track and field. It's just the height of this. Does that make more sense? Okay, no problem. Yes, yes, the noodles. Hmm. Okay, yeah. That there's so many creative things that people can use just because if you know what you need to do, it's just being able to get something that's going to allow you to do it. Yep. Absolutely. People get so creative, and I think that's the beauty of it and why like I didn't know some of this stuff even existed until I have, people that come through the door and they tell me all the creative things that they've done, and we take those and we will pass them along. Exactly. And you're looking for cheap, non-expensive options to be able to continue to do what it is that you need to do. And something, it's as simple as that. You would be shocked at how I had a patient one time that she didn't have weights at home, didn't want to buy weights, so she took soup cans, put them in a grocery bag, and she would tie it around her foot and she would do kicks with that. Just you get as creative as you need to be able to get whatever it is that you need to get done. So, no, that's a great point. Yeah. Okay. I did not bring any occupational therapy adaptive equipment because there's a ton of depth that you have the button, you have shoe lifts or shoe horns, you have sock aids, you have reachers, there's so many different OT kind of activity of daily living devices. We just got a couple, again, like I said, I'm very into, if I want to recommend it to a patient, I want to try it on them first. So those grab bars that suction cup to the wall. A lot of us therapists wise are very hesitant of that because to me it scares me, suction cupping and then putting all your weight. So we just bought a couple different kinds that we literally just got in yesterday, and I want to try putting them up in our bathroom in the gym and then kind of hanging on them to see, are they going to hold somebody's weight? And we hear great things about them. Again, we are always skeptics until we can try it. So that's a good point. Yep, to make sure. That's a good, I will take that back to our folks. Yeah, so that's one thing that, like, we're always thinking about safety. So that's one thing that we wanted to try just to see what was out there. Yeah, good. No, that's good to know. Yes. And I think the therapist in us always go to like worst case scenario or like worst thing that can happen. But checking it, I agree. That's definitely every single time. Yeah. No, thank you. Yeah. So I don't know the answer to that, to be honest. We direct a lot of our patients to Amazon, like I said, because they're cheaper options. You can go through DME companies like Blackburn's, AHN, Select Specialty. I mean, there's a lot we work with probably 30 DME companies, which stands for durable medical equipment, if you're not sure. And some things, like I said, are covered by insurance. The challenge with mobility devices is that insurance covers one every 5 years. So if you need to get a wheelchair and a walker at the same time, my suggestion is have insurance cover the wheelchair because it's more expensive, and then privately pay for the walker because they won't cover both. There's a lot of nuances too. You can't get a slide board unless if you're getting a wheelchair or have a wheelchair, the insurance won't cover it. There's a lot of, like, I've learned so many different, more than I want to know, issues with insurance and durable medical equipment. But sometimes families will find things on like a Facebook marketplace. Just if it's, something that's been used, but again, you want to check it and make sure that it's safe before you actually take it or use it. But sometimes we'll recommend things, or they will come to us and say, I found this on Craigslist, I found this on Facebook Marketplace, what do you think? And again, we always say, can you bring it in so we can try it? Because we would rather it fail while you're there with us and we can try to keep you safe versus you trying to do it at home. Yeah. Yeah. It can take, agreed, because some insurances, they need authorization for every little thing. So I agree. That's a lot of times why we're directing, people to, because most people have an Amazon account, or their kids have an Amazon account, or some family member has an Amazon account with Amazon Prime where you can get it the next day, free shipping. So yeah, that's usually the website that we will recommend, but you can get some of this stuff, the more common things at like a Rite Aid, Walmart. They sell walkers, bedside commodes. The other thing that was on there real quick was a shower chair. So you can use that in the shower, but we actually teach patients to use it on the stairs too. Just like the rock steady cane, you can adjust the legs so that one leg's on top, one leg's on the bottom, or two sets. So for people who can't climb the stairs, but they can do a sit to stand, if these are the rails and I'm sitting on the shower chair, all you need is to stand up. Somebody picks the shower chair up and moves it up to the next step. You sit back down. So all you're doing are sit to stands. So we will practice with our patients with those if they're truly struggling. Because again, sometimes that can make or break whether somebody has to go to a nursing home or can function at home. So a shower chair is a technique that not many people know about, but you can try it, because again, if anything where the legs can be adjusted, you can essentially use that on a stair. But again, you would want somebody like a home health therapist or somebody that's going to be trialing that with you on your stairs at home to see, is it going to work, before you just throw a shower chair on the stairs and hope for the best. So any other questions? Well, thank you very much. I appreciate it. Thank you.
Great. You?